Lindsey Vonn has always been one of the most fearless names in alpine skiing, known for speed, power, and unmatched resilience. Lindsey Vonn's injury happened during the downhill race. Reports indicate she suffered a vital forces. Even a small imbalance can produce catastrophic impact because Why is a left leg fracture so serious for a downhill skier? The left leg is not simply a support structure. In downhill skiing, both legs act as shock absorbers, steering mechanisms, and stabilizers. A fracture disrupts the entire kinetic chain, meaning balance, edge control, turning. Did Lindsey Vonn require? Medical reports describe a complex fracture requiring multiple surgical interventions. These procedures typically involve stabilization through fixation methods, aligning bone fragments properly, and protecting surrounding soft tissue. This is often the first step before longer-term reconstruction and rehabilitation. Why do complex fractures often require more than one operation? In high-impact injuries, surgeons may first stabilize the leg to prevent further damage, then perform follow-up procedures once swelling decreases and tissues become safer to operate on. This staged approach is common in severe orthopedic trauma. What makes recovery from this kind of injury especially difficult? Bone healing is only part of the battle. Elite athletes must also restore muscle strength, neuromuscular timing, joint stability, and confidence. For a skier, recovery means rebuilding the ability to tolerate violent compression forces at racing speeds. How does age affect Lindsey Vonn's recovery outlook? At 41, the body's healing capacity is different than it was in her 20s. Recovery can take longer, and the risk of complications such as chronic pain, stiffness, arthritis, or re-injury increases. This makes the decision to return to elite racing far more complex. Why is biomechanics central to understanding her situation? Downhill skiing is one of the most biomechanically demanding sports on Earth. Athletes generate enormous torque through the knees and hips. When structural trauma occurs, the body must compensate, often placing dangerous stress on other joints. What role does Alan Kildow play in this moment? Publicly expressed a firm belief that this injury should mark the end of her competitive career. His comments reflect deep concern about long-term health rather than short-term ambition. What was Alan Kildow's medical ultimatum in simple terms? He has suggested that continuing to race after such devastating injuries is no longer worth the cost, emphasizing that her future mobility and quality of life should come before another comeback attempt. Why would a parent take such a rigid stance? From a medical risk perspective, repeated trauma increases the likelihood of permanent damage. A parent who has witnessed years of surgeries, rehabilitation, and pain may prioritize lifelong function over additional competition. How does this injury affect Lindsey Vonn's Olympic outlook? This crash effectively ends her immediate Olympic participation in the current event. Multiple surgeries and long recovery timelines make a return within the same games impossible, shifting the focus entirely toward rehabilitation. Could Lindsey Vonn still attempt another comeback in the future? While elite athletes are known for extraordinary resilience, a return after complex fractures at this stage would be medically challenging. Any future decision would depend on healing progress, joint stability, and whether her body can safely handle racing forces again. How does this reshape her legacy? Rather than weakening her story, this moment highlights the reality of what it costs to compete at the highest level. Her career already represents historic dominance, and this injury underscores the extreme sacrifice behind that greatness. What does this situation teach about athlete longevity? It shows that elite sport is not only about courage and talent, but also about biology. Even legends must eventually confront structural limits, and longevity becomes a balance between passion and preservation. Is Alan Kildow's intervention changing the narrative? Yes. His stance reframes the comeback discussion from emotional inspiration to medical realism. It forces the public to consider whether continuing is heroic or unnecessarily dangerous. What is the biggest challenge ahead for Lindsey Vonn? The hardest part will not only be bone healing, but rebuilding the complete biomechanical system required for downhill racing while protecting long-term health. Finally, Lindsey Vonn's left leg surgery is more than a sports headline. It is a powerful example of the brutal physical reality of elite competition. Alan Kildow's uncompromising stance reflects the seriousness of repeated trauma and the importance of long-term well-being. Whether this marks the final chapter of her racing career or simply another moment of resilience, her legacy as one of the greatest alpine skiers in history is already undeniable. Thank you for watching. If you found this breakdown helpful, please don't forget to like, share, and subscribe for more educational sports analysis and athlete recovery stories.